Do you have diabetes? Have you noticed lately any problems with your skin, such as itchiness, dry flaking skin, red spots, or dampness in between the toes? It could be tinea pedis, which is commonly known as athlete's foot. Okay, so let's talk about athlete's foot today and how to manage it, particularly if you have diabetes. In this video, we will talk about what athlete's foot is, what causes it, how to prevent it, and how to treat it at home. Okay, so let's talk about athlete's foot. Athlete's foot is a fungal skin infection and it is often found in between the toes and on the skin of the foot. You don't need to be an athlete to get it. It commonly occurs in people with sweaty feet, poor foot hygiene, or even in occupations whereby occlusive footwear is worn, such as Wellington boots or steel toe cap boots. Also, if you don't have much space in between your toes, it can cause moisture and warm, irritated skin. Fungal thrives in this type of environment, which will further infect the upper layers of the skin. There are a number of signs and symptoms for this condition which you can note at home, such as scaling, peeling, or cracked skin in between the toes. Itchiness, especially right after removing socks or shoes. You may notice inflamed skin that may appear reddish, purplish, or greyish depending on your skin colour. You may even experience burning or stinging, or even notice blisters, or dry, scaling skin on the bottom of your foot that extends up the side. Let's talk about treatment. We want you to contain the infection as soon as possible. You need to keep your feet clean and dry. Wash your feet twice a day and gently towel dry between the toes. If you're unable to get the towel in between your toes, a simple piece of kitchen paper such as this will easily get in between your toes. At home, you can use an antifungal product such as Lamisil cream. It's 1% terbinafine hydrochloride and is really effective in treating athlete's foot. You may need to experiment with the product formulation, such as ointments, gels, or creams, lotions and powders. See what works for you. Try not to scratch at your rash so you do not cause a wound on your foot. You can try soothing your itchy feet by soaking them in a cool bowl of water. You do, however, need to sterilise your footwear and socks. You can pop your socks into the washing machine at 60 degrees to kill the fungal and spray your shoes with Dettol. Let's talk about prevention. Changing your socks regularly will help to eradicate fungal spores. Often, if your feet get really sweaty, you're at higher risk of developing athlete's foot. Wear light, well-ventilated footwear. Avoid shoes made of synthetic materials such as vinyl or rubber shoes such as wellies. Wear sandals where possible to let the air get to your feet. You need to alternate your shoes. Using different shoes from day to day will give the opportunity for your shoes to dry out. Well, what will happen if you leave the athlete's foot untreated? The condition is incredibly contagious, so you need to be careful. It can spread through towels, floors, clothing, or shower trays. It can lead to bacterial infections such as cellulitis, and it can also cause fungal nails and spread to other parts of the body, causing infections such as jock itch. People who have diabetes are at particular high risk of developing athlete's foot. If you scratch the skin when it's itchy, you can cause tears in your skin, which can lead to ulceration, and this is a really serious issue for people that have diabetes. With diabetes, you may experience sensory neuropathy, which means you can't really feel your feet as well as you should, and a chronic fungal infection could lead to non-healing diabetic wounds and ulcers, and in severe cases, amputation. If you are still concerned after watching this video today and you're still worried about your feet, then please do contact your local podiatrist for more help and more information, particularly if your infection hasn't cleared up. We can help to confirm the diagnosis and to rule out other skin conditions such as dermatitis and dry skin, and even take a skin scraping from the affected area for testing in a lab if required. Thank you.